Hello, welcome to Flexibility and Mobility for Runners workshop. My name is Rebecca Eagles. I am a fitness and sports instructor from CFB Petawawa, and let's get started. So, an outline of what we're going to be talking about today. We're going to be talking about flexibility versus mobility, the difference between the two. We're going to talk specifically about mobility training, the importance of it. We'll go over a little bit of biomechanics, some common injuries, as well as injury prevention, and then we will talk a little bit about training considerations, proper warm-up, proper cool-down, as well as training techniques. So to kick things off, we are going to start talking about flexibility. So the definition of flexibility can be defined as the ability to passively achieve an extended range of motion. This is a common goal for many individuals, mostly with the idea that flexibility prevents injury, increases performance, or helps develop a more athletic look. This being said, this is actually not the case. New research has shown that flexibility training does not prevent injury, it does not help with increasing athletic performance, and does not have any effect on creating a leaner or more athletic look. It pretty much creates almost this useless range of motion due to the fact that you have no control in this extended range. Flexibility is a component of mobility, but great flexibility is not necessary for performing functional movements. Moving into mobility. Mobility is defined as the ability to actively control a specific range of motion with no restrictions. It is needed to perform functionally and efficiently. Your joints need to be mobile in order to reach the proper range of motion. Improper movement techniques or patterns due to the lack of mobility can lead to injury, poor technique, and inefficiency. Mobility should be implemented into your daily routine. So this chart here shows what joints in the body need to be mobile in order for good range of motion, good technique, all that good stuff. So when a joint is meant to be stable and is moving, then we have run into some issues, as well as vice versa. So if a joint or a series of joints are not moving in the range of motion in what they need to be, the risk of injury, poor technique, and inefficiency is increased. So for runners, we know that they use their feet, their ankles, their knees, their hips, as well as their spine. So you can see with this chart here, let's say your knee is moving in a direction in which it should not be. So your knee is supposed to be stable for the most part, but if it's moving, then we've run into some issues and injury is greatly increased. Moving into the benefits and importance of mobility training, there are prerequisites for all movements. If you lack in the foundation, your overall movement patterns will be compromised. The risk of injury will also be increased. So this little chart here or picture on the side just shows you that mobility and stability are the foundational bricks, if you will, of all movements. So in order to have good muscular strength, muscular power, muscular endurance, you need to be mobile and to be stable and have good movement patterns. With this, you will obviously eventually get up to skill, but you cannot get here without having good mobility, good movement patterns, all of that good stuff. Moving into some biomechanics, runners need good mobility in order to run properly and efficiently. Good mobility translates into a strong upward knee drive, adequate hip extension, and proper glute activation, all of which is needed for short and long distance running. The feet, ankles, knees, hips, and the spine are all affected by running. So ensuring good range of motion or mobility is essential for all runners in terms of proper technique, injury prevention, and overall efficiency. Adequate mobility in these joints is the answer to most common injuries that come with running. So a lot of times you will hear people say they need orthotics or they need shoe inserts. Maybe they're getting electric stimulation to help with the injuries that they have come to. This, however, is not going to prevent as many injuries as good mobility will. So if we refer back to the previous slide here, like I mentioned before, mobility is the foundation of all power, strength, endurance, skill, all movements. So if you don't have good mobility, you cannot have good strength, good power, good endurance. A lot of people who tend to have a lack of mobility tend to be those who sit majority of the day. So if they have a desk job, or if you are a master runner or an older runner, as well as injury prone runners. So these individuals tend to run into more range of motion issues. These individuals that I just described most likely have tight hip flexors, tight quads, tight psoas muscles, inactive glutes or hip muscles, and a reduced mobility due to inactivity. Older individuals tend to have a higher risk of strength declines as well as decreased risk of range of motion. Runners with great mobility are more capable athletes who have a decreased risk of injury, stronger muscles, better coordination, and better technique and proprioception. They can also make more training mistakes without having a greater risk of injury. Some common injuries that we see with runners specifically are just listed here on this slide. So the causes are there as well as the symptoms. So you can see that there are quite a few common injuries that occur from running. So whether these are due to the lack of strength or coordination or improper warm-ups, the risk of injury is greater for those with improper recovery, improper movement patterns, and the improper range of motion or mobility. So injury prevention should always be your number one goal while training. You should not be starting a program expecting to get injured. That's not something that you should be almost planning to happen in your training program. With proper progressions, mobility and strength training, as well as recovery, your results can be maximized and injuries can be avoided. Injury prevention. Your lifestyle is very different from individual to individual. Some things that go into consideration here can be listed as genetics, training volume, and other lifestyle factors. This being said, if you learn to move the way your body is designed to move, you will put less stress on your system. If you are always bending down to grab your gym bag off the floor with a rounded spine, or you are constantly sitting at your desk with poor posture, your risk for injury greatly increases. Let's say you are training in the gym for 1 to 2 hours per day. The other 23 to 22 hours a day add up to being more than the 1 to 2 hours you spent in the gym for your training session. In short, you need to pay attention to your daily living activities and movement patterns to ensure you're carrying out the same practices as you were if you were in the gym. It is very important to note the signs of improper movement qualities. So these include pain, swelling, loss of range of motion, decreased force production or strength, and numbness or tingling. So training considerations for a warm-up. Having a proper warm-up is key to great performance. It warms the body and increases blood flow to the joints and working muscles. It helps increase the mind-to-muscle connection, which wakes up your muscles and helps increase the range of motion. Including dynamic stretches or exercises is an appropriate way of warming up. So you can include things like high knees, butt kicks, other dynamic exercises in your warm-up. You should, however, never include static stretching in your warm-up. Stretching this way decreases the force absorption capacity in the tissues and poses a greater risk for pulling a muscle as well as injury. A proper warm-up can also include activities such as myofascial release, so foam rolling. You can include corrective and activation exercises. So if you are the type of person that has problems with their glutes firing during your run, you can implement glute firing exercises in your warm-up to ensure that activation carries through to your training session. You can also include foundational movement patterns, so anything that is going to assist you during that run. So training considerations for your cool down. Proper cool down techniques will assist in avoiding DOMS or delayed onset muscle soreness and clearing lactic acid from working muscles. Activities to include can be light cardio exercises. So you could walk, you could jog, you could row, you could bike, all of those things there. You can also include static stretches in your cool down, as well as myofascial release, meditation, or breathing techniques. The goal of your cool down is to get the body to return to a resting state or homeostasis. Skipping a cool down or rushing through it poses the risk of remaining in a higher state of arousal or stress, including some type of down regulation exercises. So what I mentioned before about your breathing techniques, meditation, light cardio, etc., helps bring the body down from a fight or flight state back down to resting. So it's important to have a variety in your training. Mobility training is fairly easy to accomplish, but running at an easy effort 3 to 4 times per week will not boost or help you maintain mobility. Including activities such as hill workouts, sprints, trail runs, strength and conditioning training sessions allow the body to train in a different range of motion and creates as well as maintains mobility. These exercises also assist in building strength, coordination, balance, agility, power, etc. all of those things that I listed just now are required for running as well. Training considerations, mobility training, test and reset. Use mobility exercises as tools to measure within the context of the movement and or pain. So an example of this would be if you were to start in a deep squat position, you can determine what tissues feel restricted or tight. Then you can implement foam rolling or mobility exercises to see if you can release that tension or tightness. Once you have completed your foam rolling or mobility exercises, then you would reassess. So go back to your deep squat position. This allows you to know if what you are doing is actually working for you. So using your new range of motion right away allows the body and the mind to keep track of your new range for upcoming movements. If it feels sketchy, it's sketchy. Mobilizing restricted tissues is uncomfortable. So if you have ever foam rolled your IT band or tight hip flexors, I'm sure you can relate to that statement. There is a difference, however, between discomfort and pain. So if you think you are injuring yourself, you probably are. Mobilizing is uncomfortable, but it shouldn't be feeling like you are doing more harm than good. This is where you need to be in tune with your body and you need to pay attention to those cues. No days off. Note that lifting a 250 bar off the floor for a deadlift is no different than picking up a pillow off the ground. Obviously, other than the weight, both of these movements require conscious awareness of the body. So if we go back to a few slides ago, we talked about how the other hours of the day make up more than what your training session does. So carrying out those same practices in your daily living will help in your mobility. Make your mobility realistic. Prioritize mobilization techniques that are realistic to real life situations. The more you replicate what you are trying to change, the more you will improve in your position. Always mobilize in a good position. Keep movement principles in mind as you mobilize. You should always be in a good position prior to starting to mobilize. Don't get stuck in one position, explore your business. You should know more than anybody else where you are feeling tight or restricted. As long as you maintain good form and avoid falling into bad positions, you should feel free to explore your dysfunction and move into newly challenged areas. Don't make a pain face. It shortens your neck flexors, causing restriction along the athletic chain. So this ultimately makes mobilizing a lot more difficult. Spend no less than 2 minutes in each position. Research indicates that it takes at least 2 minutes to make soft tissue change. Anything less than that, you are not getting the full benefit. Choose 3 to 4 mobilization exercises or techniques to mobilize. Implementing mobility will change from day to day depending on your current areas of restriction, the movements you are performing, and the positions you will be in. The key is to constantly work on your position and spend the necessary time doing basic body maintenance. Training considerations. We're going to talk about some mobility exercises that you can implement into your daily routine. So just to name a few, the first one here is a foot eversion and inversion. So you can loop a long band around your foot and then anchor it to a table or a chair. Keeping your knee and your hip stationary, move your foot outward for a count of 3 to 4 seconds and then slowly return to the center. Repeat that same sequence in the opposite direction, coming back to the center each time. Repeat for no less than 2 minutes and then switch sides. The second one here is an ankle mobility exercise. So stand facing a wall with one foot as far away as possible, but allowing your knee to touch the wall when it's bent. So you will bend your knee and try to get it as close to the wall as possible, then slowly return to the starting position. Pause for about 3 to 5 seconds with your knee close to the wall, and you should feel this stretch in your ankle and your lower calf. As you improve, you can move your foot further from the wall, with the goal still being to eventually bring your knee to the wall. Repeat the above for no less than 2 minutes per side. The last one we will talk about here is for a hip mobility drill. So start with your legs at 90 degrees. So you'll have one knee here in front of your body and the other knee behind you here, both still bent at 90 degrees. And then you will square your hips to face the front knee or square the front hip. You will then hinge your front body or your upper body forward, aiming to get your torso as close to your thigh as possible. You can keep the movement fluid and hold for 3 to 5 seconds in this bottom position here. Repeat this sequence for no less than 2 minutes per side. So the summary of this workshop here, flexibility and mobility are very different. Flexibility is a component of mobility. Mobility is the foundation of all movements, so you cannot have good strength, endurance, good skill without having good mobility. Injury prevention should be your number one goal at all times. You should never just expect to get injured and feel like it's just a part of training. Proper warm-up as well as proper cool-downs should be implemented before and after each training session. Include a variety of training sessions to optimize your mobility, so things like strength training, conditioning work, hill runs, trail runs, all that good stuff. The last takeaway here is to work on your mobility daily and to understand that day to day your needs will be different. And here is just the last slide of my references here.